Capacity building in research infrastructure, tools and data from Balkan region for food systems-based dietary guidelines development. Capacity development in food and nutrition is of great importance and extends beyond formal training. This process encompasses the development of human resources, organizational, institutional, and legal frameworks, with the goal of enhancing knowledge and skills. It is a long-term and continuous process that focuses on national priorities, policies, plans, and procedures. Since the establishment of CAPNUTRA, the main objective has been and continues to be the stimulation of capacity development in food and nutrition in Central and East European countries. This is achieved through the identification of research infrastructure, recognition of status and needs, a focus on education and training, and the establishment of networks with European countries through collaboration in international networks and research projects. CAPNUTRA works toward the enhancement of individual, institutional, and organizational capacity in food and nutrition research, identifying the challenges and needs, the strategy development, including the activities of guidelines planning for countries in this region. Having adequate research infrastructure in the domains of food nutrition and health is crucial for nutrition epidemiology, innovative nutritional research, dietary exposure assessment for food safety and risk evaluation, as well as the development of effective public health nutrition strategies aimed at addressing diet-related diseases, malnutrition, and foodborne diseases. The research infrastructure serves as a platform for interdisciplinary and multinational collaboration, with the aim of facilitating world-class research. This includes the associated human resources, major equipment, a set of instruments, as well as knowledge-containing resources such as collections, archives, and data banks. The research infrastructure can be categorized into two subtypes: hard research infrastructure, which includes major buildings, equipment, instruments, and knowledge-containing resources, and soft research infrastructure, which encompasses data management, interpretation, and handling capabilities, data and procedure harmonization, staff training, professional networks, and knowledge transfer. During the previous period, the activities in Serbia and Balkan region, as part of the research infrastructure, identified that the existence of harmonized methodology and validated tools is very important to achieve accurate dietary intake assessment at the individual and population levels. This approach is required in dietary surveys and nutrition surveillance systems. We also identified that research infrastructure and capacity development are prerequisites for harmonized public health nutrition, research, and nutrition epidemiology in the Balkan region. In Central East Europe and the Balkan region, we identified a lack of research infrastructure, particularly in the areas of food composition data, dietary assessment tools, and standardized dietary intake data. To address these identified gaps, in recent years the Center of Research Excellence in Nutrition and Metabolism worked with CAPNUTRA on development of food and health research infrastructure and capacity through several EU projects. This work specifically aimed to develop harmonized food composition tables and dietary assessment tools in compliance with all European standards and recommendations. Harmonized and standardized food consumption data collection is important for identifying food consumption patterns, estimating nutrient intake, supporting nutrition surveillance. These surveys are significant for evidence-based nutrition policy making, food legislation, and improving the accuracy of exposure assessment to nutritional and food safety hazards. The data collected in these surveys are dominant input for developing food system-based dietary guidelines.
Diet Assess and Plan is an advanced nutritional tool for food consumption data collection, comprehensive dietary intake assessment and nutrition planning. This tool is an important segment of the research infrastructure for nutrition epidemiology and public health nutrition. The data management system is designed and developed in compliance with European food standards and guidelines, enabling additional coding through the integrated international Langwall framework for food description, and the Food X2 coding system developed by the European Food Safety Authority for food risk assessment. The Diet Assess and Plan tool has been evaluated within the European Food Safety Authority project, dietary monitoring tools for risk assessment, and fulfills the criteria for standardized food consumption data collection within European Food Safety Authority's pan-European dietary monitoring and risk assessment projects. A nutritional tool designed for standardized and harmonized collection of food consumption data, comprehensive assessment of dietary intake and nutrition planning. The main components of this tool are food composition database, food intake evidence including 24-hour recalls and food frequency and food propensity questionnaires. The diet planning provides functionality for planning and modeling personalized diets, nutrient intake and adequacy assessment. The food composition data management tool consists of over 2,000 food and recipe items commonly consumed in the Balkan region. The database is designed in compliance with European food standards and guidelines, ensuring compatibility with 40 other food composition datasets hosted on the common European food data platform. The integration of the Language Thesaurus, an international framework for food description, enables standardized food descriptions within the database. Furthermore, the FoodX2 coding system developed by the European Food Safety Authority for risk assessment of food items is implemented. The food composition database follows a hierarchical structure with 3 levels. The highest level provides general identification of food items. The next level includes a list of nutrients along with their respective content for each food item. The lowest level includes additional value specifications for each nutrient. The food composition data management tool is available online and can be accessed using user credentials. The content of the food composition database is generated, maintained and continuously updated by our proficient team of food compilers and scientists in the fields of nutrition and public health. The tool provides convenient sorting and search options for food items, allowing users to filter based on criteria such as food name, food group, and other selection parameters. It offers a tabular overview of all the foods present in the database, facilitating easy access to information. Selecting or editing a specific food item, the tool displays detailed information about that particular food. In addition to general information, the data is organized into separate sections. Nutritive values, this section provides detailed nutritional information about the food item, including its composition of various nutrients. Recipe calculation calculates the nutrition value for the recipe by taking into account the ingredients, amounts, cooking methods, and applying yield and retention factors. Language coding utilizes the international framework for standardized food description, enabling consistent labeling and categorization of the food item. FoodX2 coding incorporates a section for FoodX2 coding, which is developed by the European Food Safety Authority and aids in risk assessment related to the food item. These separate sections ensure comprehensive information and functionality related to nutritive values, recipe calculation, and coding systems for standardized food description and risk assessment. The food composition database has a regional focus and includes food names in multiple languages spoken in the Balkan region. In addition to the original and English food names, the database is extended and the food names are registered in Serbian, Macedonian, Albanian, Bosnian, Montenegro and Hungarian. For each food item in the database, additional information is entered, including food origin, food group, food subgroup, supplement categorization, industrial categorization, and evidence of allergens. Standard portion sizes can be uploaded and displayed with pictures. The lower part of the screen is dedicated to displaying other food attributes. The most important is the nutritive information. The food composition database operates with a standard list of predefined macronutrients, priority micronutrients, and vitamins. However, specific nutrients and compounds can be added if needed. The list of nutrients, their names, and descriptions are harmonized with Eurosphere component thesauri. The recipe calculation is the next set of food attributes. It includes a space to provide a recipe description or instructions for the recipe. General cooking method can be selected from the standard list of cooking methods. Indication of the number of people the recipe amount is intended to serve. Cooked recipe amount, specifying the cooked amount of the recipe after the implemented cooking method. For each ingredient, the raw food amount and unit can be assigned. If necessary, separate cooking method can be applied for the ingredients. At the recipe level, The tool automatically calculates the yield and retention factors from each ingredient based on the selected cooking method. Additionally, individual Food X2 codes can be added for each ingredient, providing further coding information. The Food X2 classification, developed by the European Food Safety Authority, focuses on declaring food items from a risk assessment perspective. It assigns appropriate identifications for various aspects such as food source, fat and alcohol content, sweetening, fortification, packaging, ingredients, process, and other group criteria. The data in Food X2 follows a hierarchical structure. It utilizes two types of classifications, hierarchy-based and facet-based. The signs accompanying the Food X2 items indicate their position and importance within the hierarchy. In addition to the main food composition database, there are three more databases within the system. The table of chemical components allows users to establish a flexible environment for creating an active component list for the food composition database. It also helps in organizing the contents of reports related to food intake. The nutrient recommendation database gathers recommendations for nutrient intake for different population and age groups. These recommendations can be published at the country or organization level and also include specific guidelines for certain diets or health conditions. The nutrient recommendation database serves as a valuable resource for assessing nutrient intake adequacy, analyzing diet patterns, and facilitating diet modeling and planning. The yield and retention factor database serves as a centralized source of information regarding the percentage yield factors for different foods based on the specific cooking methods applied. It acts as a connector and unifier, ensuring consistency and accessibility of data related to the yield and retention factors. By accessing this database, users can easily retrieve and utilize the appropriate yield factors for various foods. This helps in calculating the nutritive values of cooked foods and allows for more precise analysis and assessment of nutrient intake. The questionnaire is designed according to the standards to measure the habitual consumption over the time period of 3 months, registering the frequency of the food consumption and the average consumed amounts in case of food propensity questionnaire. It can be implemented on individual as on population level. The questionnaire is available on standard English language and on languages commonly used in Balkan region. It consists of 3 sections. General data. This section includes demographic information, consumption habits, anthropometry, and questions related to food allergies. The content of these questionnaires, including a list of questions with a categorized list of predefined possible answers, has been developed in accordance with the standards recommended by the European Food Safety Authority. The next section of the questionnaire focuses on the food consumption registration. This section contains the list of food items organized by food groups. For each food group, the common and representative food items are displayed along with predefined consumption frequencies as never, less than once a month, 1 to 3 times per month, once per week, 2 to 3 times per week, 4 to 5 times per week, and 6 to 7 times per week. In case of food propensity questionnaire, the field for the average consumed food amount is also presented and available for data input. Additionally, standard predefined portion sizes with illustrations, such as small, medium, large, and extra large, are presented alongside each food item. At the end of the food list, the questionnaire also includes information on dietary supplements. This section focuses on the consumption of commonly used vitamins, minerals, and other dietary supplements. The data input list for these items includes fields for the consumed dose, period of consumption, and the brand name of the supplement. Due to the integrated platform, the representative food items in the questionnaire are linked to the foods in the food composition database. This enables the interactive calculation and evaluation of the nutritive values for the filled questionnaire content. As a result, the tool calculates the average nutrient intake, focusing on priority macronutrients, micronutrients, and vitamins. Additionally, it presents the average consumed food amounts for different food groups and food origins, along with the distribution of energy and macronutrients. This tool can also be used as a quality control tool in compliance with the 24-hour dietary recall questionnaires. The Food Atlas for adequate assessment of portion sizes of commonly consumed food items in food consumption surveys for Balkan region. The Food Atlas is developed to help respondents estimate the amount of consumed foods. Based on previously conducted food consumption surveys in the Balkan region, the most consumed foods and recipes were selected for the Food Atlas. Additional dishes from traditional cookbooks and restaurant menus were also included to address the local dietary patterns and improve cultural competency of the atlas. Food quantification is an important factor for the accuracy of food consumption surveys. CAPNUTRA team developed and validated the Food Atlas of the most frequently and commonly consumed foods and dishes in the Balkan region with the aim at improving precision of portion size estimation. In food consumption surveys, a list of 146 foods, dishes and utensils was carefully created based on previously conducted food consumption surveys in the region. The Food Atlas is a pictorial guide of 146 representative national regional usually consumed foods, with common portion sizes and photos. The typical foods and most consumed dishes in the Balkan region were prepared, cooked, measured and served in 3 or 4 portion sizes right before being photographed. Dishes consumed in a home environment are usually served using different ladle or other utensil sizes, while beverages are often consumed directly from the original packaging such as cans, bottles or paperboards. Thus, 5 utensils, 6 different types of liquid packaging, and baby bottles are represented. The Food Atlas might be used for the assessment of other food items and dishes not included in the Food Atlas but of similar appearance, shape, and texture or composition like ones presented in the methodology of portion sizes is a very important step in the Food Atlas development process. Photo series of selected food items and recipes consist of 3 or 4 photos per series, depicting a range of portion sizes in increasing order. Food items like standardized bakery products, standard traditional dishes, food items that could be served in diverse ways were presented as a single photo or in more than 4 photos. A unique numerical identification code was assigned to each food item. Photographs within series were labeled with uppercase letters and arranged alphabetically to assign a gradual increase in portion size. In order to avoid response bias and misreporting, actual weights of portions were not indicated in conjunction with photographs, but at the end in a separate codebook. A validation study was conducted through the visual perception of food portions by comparison with a photo series of shown food to test its relevance, accuracy and applicability between the users. The study sample involved 2 groups of volunteers, 18 professionals and 17 subjects without any formal training or professional experience. The study was designed to have 20 photo series evaluated through 40 food portions with 2 different randomly selected portions of each food item. The Food Atlas is validated on the Symposium on Sustainable Food Systems for Healthy Diets in Central and Southeastern Europe countries, with integrated training on food consumption data collection and strengthening the thematic regional networking. The strength of this study is that this is the first Food Atlas to be developed in the Balkan region containing the most consumed food items and dishes and validated according to approved methodology. The tool allows the input of foods, beverages and food supplements consumed during the survey days in accordance with common 24-hour food diary recall rules. It has been developed in accordance with the EU menu guidance and covers coding standards for general and consumption data, as well as FoodX2 coding. During the data entry process, the tool allows for automatic searching, description, and quantification of each item using appropriate quantification methods. This is followed by probing questions and forgotten item questions to ensure comprehensive data collection. The 24-hour questionnaire is supported by a food picture book that provides country-specific portion sizes and household measures. The questionnaire also supports the computer-aided personal interviewing, enhancing the efficiency and accuracy of data collection. The 24-hour dietary recall protocol follows a standardized pathway during the interview, following a formal structure developed based on the stepwise procedure. The general part of the questionnaire collects information related to the subject, including age, date of birth, population group, gender, and the date of evidence. The questionnaire supports the regional language selection. The non-dietary information section of the questionnaire covers a wide range of data, including demographic questions such as settlement type, labor, occupation, education level, marital status, and the number of household members. This section provides a standardized list of predefined answers. The next section focuses on dietary habits, including questions about the presence of any diseases or medical conditions, medication usage, and smoking status. Standard body measurement questions are also included to gather information about the participants' physical attributes. The questionnaire also addresses food allergies, with specific questions regarding potential foods causing allergic reactions. Furthermore, the questionnaire incorporates the standard International Physical Activity Questionnaire, which assesses the participants' level of physical activity by categorizing it into high, moderate, and low intervals. The 24-hour food consumption questionnaire consists of 3 parts. The first section collects information about the date of consumption, season of the year, weekday, and any specific details about the daily consumption. The middle part of the screen is dedicated to the registration of food items consumed during the 24-hour period. The tool, based on the Integrated Food Composition Database, automatically calculates the consumed food amount, energy intake, and macronutrient content at the day level. Dietary records capture information allowing participants to describe their dietary intake with unrestricted specificity and detail. The formal structure of the diary follows the stepwise procedure of the dietary recall interview for each consumed item. It includes fields for time, meal type, place of consumption, and food identification. The participants can search and select food items based on their names and food groups. The tool provides information about recipes, ingredients, and nutritive values for the selected food items. Integrated pictures from the Food Atlas help in better estimation of the consumed food amounts. For supplements, the questionnaire gathers additional information such as dosage, mass, consumed units, and the supplement content. For each consumed food item, additional information based on the Food X2 classification declared by the European Food Safety Authority can be provided. This classification is integrated into the Diet Assess and Plan tool and includes important data for risk assessment, including details about sweetening, fortification, qualitative information, packaging material, and preparation method. This information enhances the understanding of the characteristics and properties of the consumed food items, contributing to a more comprehensive assessment of dietary intake and potential risk factors. To ensure the quality of the obtained data, the debriefing session is conducted at the end of the recording period. During this session, at the end of the page, the interviewer reviews the dietary records with the parent caretaker to address any potential omissions, uncertainties, or missing information. The gathered data for each 24-hour dietary recall day can be easily printed or exported into an Excel format. The reports can be generated on individual or group level. The generated reports provide valuable information and different distributions on dietary patterns, including food intake data, process data on food consumption. The reports process the data for different food groups, calculate the percentage of energy value derived from each food group, nutrient intake such as energy, macro and micronutrients, and contribution of food groups and meal types to the total nutrient intake. These reports enable assessments of nutritional status and adequacy based on the collected data.
Tools and data from Balkan region for food system-based dietary guidelines development. In the Balkan region, the Diet Assess and Plan tool was selected as a technical solution for the EU menu survey supported by European Food Safety Authority. This project in Europe began in 2011 and was conducted in all European Union member states, as well as in 4 pre-accession countries, across various age groups, using a consistent method, allowing result comparisons. The survey aimed to provide high-quality dietary intake data for conducting exposure assessments of foodborne hazards and estimating nutrient intake in remit of European food safety agencies, scientific committee, and scientific panels. Prerequisites for this survey included a dietary software tool, a food composition database, and survey questionnaires. From 2017 to 2022, the Diet Assess and Plan platform supported national dietary surveys, ensuring compliance with the EU menu methodology for successful regional cooperation in Balkan countries, including Bosnia and Herzegovina, Montenegro, Serbia, and North Macedonia. During this period, a harmonized methodology and a unique platform were developed for food consumption data collection. Regional capacity development, knowledge transfer, and technical expertise were enhanced. A regional food composition database was developed, updated, and synchronized. The outcome of this successful regional collaboration, processed in food consumption questionnaires, administered to 9,133 participants in these national studies. The exchange of food and recipe composition data across countries contributed to the development of a regional food composition database, which now includes more than 2,700 foods, recipes, and dietary supplements. The data collected in the survey is internationally comparable with of other European countries within the EU menu program framework. The importance of capacity development and harmonized methodology for food consumption studies in the Balkan region lies in using this data for monitoring for the first time, enabling longitudinal monitoring of dietary patterns, nutrient intake, and evaluating dietary changes in the future, as well as the effects of food policy actions, facilitating the creation of food nutrition policy and food systems action plans for shifting towards a sustainable, healthy diet at the country or regional level. Based on country-specific food consumption and dietary intake data, serving as the foundation for developing the food systems-based dietary guidelines and dietary recommendations at the national level based on scientific evidence. Enabling the comparison of eating behaviors and dietary intake of the Balkan region's population with those of other countries and regions. Contributing to the monitoring of food systems transformation. CAPNUTRA, with the Center of Research Excellence in Nutrition and Metabolism and Institute for Medical Research, developed research infrastructure for harmonized methodology in food consumption and dietary intake assessment, DietAssess and Plan platform, which allows strengthening surveillance, monitoring, evaluation, and research in the field of public health nutrition. This serves as a major resource to continue working on the development of national, evidence-based, food systems-based dietary guidelines in the third stage, following the Food and Agriculture Organization methodology. According to the Food and Agricultural Organization methodology, published in document Food System-Based Dietary Guidelines, how to develop and implement dietary guidelines with a food systems approach. The development and implementation of food system-based dietary guidelines involve several steps. The first three stages are the following. The first stage is to define the mandate for the process, establish the organizational structure, goals, objectives, and work plan. The second stage is to analyze the country's situation with a focus on priority nutrition and health issues and prepare a situation analysis and evidence review report with formulated recommendations, prioritizing food-related issues throughout the entire food system and specific target groups. In the third stage, focus is on development of recommendations for on dietary pattern, based on diet modeling and formulation of multi-level technical recommendations defined in Stage 2. Key elements for the diet modeling in food-based dietary guidelines include food consumption data, from the recent National EU Menu Survey. List of commonly consumed foods, from the recent National EU Menu Survey. Common portion sizes, from the recent National EU Menu Survey. Food composition data, regional database updated in the recent EU Menu Survey. Nutrient recommendations, national, European Food Safety Authority, World Health Organization, or Nordic nutrition recommendations. Retail food prices. Environmental sustainability data. The next steps of the diet model developing process for national food system-based dietary guidelines include following a stepwise research approach, international best practices, and guiding principles recommended by the Food and Agriculture Organization of the UN. Using findings and recommendations from the situation analysis and evidence review report to provide an evidence base for relevant segments of the food system. This helps identify nutrition and health issues and nutrition-related policies and programs in Serbia and Montenegro to be addressed through the development of food system-based dietary guidelines. Identifying and prioritizing inadequate dietary intake of nutrients and non-nutrients, through the analysis and evaluation of data from the National Dietary Survey in Serbia and Montenegro. Conducted in compliance with the EU menu methodology from 2017 to 2022. Identifying and prioritizing nutrients of public health importance for the Serbian and Montenegrin populations, including evaluating reference intakes of macro and micronutrients. Identifying foods relevant for food system-based dietary guidelines, based on observed dietary patterns. Identifying and prioritizing food groups that are major sources of priority nutrients to be included in food system-based dietary guidelines. Identifying population subgroups at the highest risk of inadequate dietary intakes of certain nutrients. Utilizing linear programming to match diets to nutritional and other constraints with minimal deviations from observed diets. Constraints will include nutrient-based recommendations and upper tolerable levels for various age groups in the population. Foods or food-based recommendations and dietary habits within food groups, including only foods with beneficial nutritional profiles. Discretionary foods energy, fat, sugar and salt-dense foods amount and frequency of consumption will be limited. Population energy goals. Acceptable macronutrient distribution ranges. Reasonable quantities of foods and food groups consumed per day for each population group. Economic dimension of healthy diet cost. Environmental footprint assessments and inclusion of foods that are nutritionally rich, but underutilized to increase biodiversity aspect of diet. This video is presented at the Regional Technical Meeting on Food Systems-Based Dietary Guidelines Development in Belgrade, Serbia. The meeting is organized by the Food and Agriculture Organization of the United Nations, the Regional Office for Europe and Central Asia, Budapest, Hungary. In collaboration with Capacity Development in Nutrition. The project, FAO CAPNUTRA, Food System Analysis, and Capacity Development on Food-Based Dietary Guidelines in 5 selected countries in Europe and Central Asia, under the framework of the regional project. For more information, feel free to visit our website.